Good afternoon to our televiewers. This afternoon, I'm very fortunate to have a colleague with me. She is in the practice of psychiatry and also in the field of physical therapy. Her name is Dr. Geraldine Sayo. Good afternoon, ma'am.
Good afternoon, doctor.
Yeah, I would like to welcome you in our office here at Quezon City because of the partnership that we have established over the last couple of years. And because also of the plan that pretty soon we will launch another project through the Center for Holistic, Alternative and Restorative Medicine, the so-called Healthcare Professionals Doing Housecalls. How do you feel about this idea, Doctora, about the healthcare professionals going to the homes, the offices of patients? How do you find this approach?
This, I think, is simply back to the basics, doctor.
Yeah.
When we were young, the doctors used to come to our
Right,
house.
right.
And I think that's that I'm now a doctor myself. It's about time that I also give back to the patients who need my service, but who cannot leave their house, including the elderly. Okay, so I'm also a geriatrician. And I am involved in the wellness of the elderly. And even though I'm a psychiatrist, I practice the holistic approach, meaning I take care of the body and the mind, and also the spiritual side of a human being. Because a lot of illnesses nowadays are brought about by poor interactions between these three aspects of ourself.
Right.
Okay, so
And do you think because some doctors or healthcare professionals think that majority of patients would still like to avail of a medical center setting or doctor setting in their healthcare? Do you think, is there a basis for saying that? That the psychology is still towards going to the hospital or to the doctor's clinic?
because of the influence of the modern technology, the Western medicine, it is an acceptable concept. Of course, we have to go to the doctor and subject ourselves to the laboratory diagnostic tests in the facilities. However, not all patients can do that. It can be a plus factor if you can give the comfort to the patient if he doesn't feel well. Also help him lessen his expenses. If you can provide the medical treatment, the psychological help that he needs in the comfort of his home, then why not?
Yeah. But I also realize now that with all these portable equipment, say portable EKG, portable blood chemistry instruments, and of course doctors being mobile, and in fact there are even portable X-rays, right?
Yes.
So with this new technology, I think it's the same thing when you go to the doctor's offices or hospitals. If we have these modern portable equipments and bring it to their homes or offices.
Yes, that's very, very convenient for the patient. Of course, if you're not feeling well, the fact that you have to travel and bear the heat or bear
and the long
heat.
waiting time.
Yes, of course, if you're already resting at home and the machines are the ones that are brought to your house, it's very helpful to the patient. I'm very, very glad that these portable instruments and machines have been invented.
I know. And plus the backup of our internet and the webcams. And if the patient is just within the reach of the computer or the laptop, you can monitor patients away from them, right?
Yes, and they can even download the laboratory results.
Exactly, yeah. So I think we are ready for such kind of healthcare approach where we are able to deliver healthcare services and, of course, ancillary services to the homes and offices of our patients. And we can monitor them, not necessarily bedside, but through the use of the internet, through the use of webcams.
Yes, but also the security of the patient, feeling
Right.
of being
Uh-huh.
taken care of by his doctor.
Mhm. Of course, we cannot still substitute the human hands
Of course.
and the human touch, right? So that's why we go to the, it's the same thing, and we even send, for follow-up, we can send nurses or nurse assistants
Yes.
or say physical therapists or massage therapists.
It's still a team approach.
Yeah, it's a team approach.
And the same expertise, the same care,
Mm-hmm.
the
Yeah.
same quality of care, and the same concern, the
Mhm.
same technology.
Mm-hmm.
Then that's beneficial for the patient.
Mhm.
his
And I'm
family.
very glad, Doctora, because you understand the whole concept. Not all doctors would think this way. They are still into that medical center focused kind of health services.
I have a clinic myself, but
Mhm.
I am open to these things. Whatever I can do to help my patient,
Mhm.
if I can go the extra mile to help them, why
Mhm.
not? If I can do it.
Mhm. And I think the other advantage of using their homes or offices as as the venue for healthcare is there is a participation of family members.
Family support is very important.
Yes.
And family education
Uh-huh.
also, what's going on with the
Mhm.
patient, how
Yeah.
can they help the patient. And
Mhm.
even in offices, of course, people are so busy with their work and they may hardly find time to take care of themselves.
Mhm.
So if the doctor goes to their center or offices,
Mhm.
then of course they will be getting health care
Right.
at less cost and
Mhm.
more convenience. And they can help one another. They can
Mhm.
support one another. The employers, the
Mhm.
employees, the
Right.
co-workers,
Uh-huh.
co-managers. That's even
Uh-huh.
the lower positions. They also deserve good help.
And we also understand that the healing process, I think, is faster when you have a support group, right? Is this something like established fact, Doctora, that
Yes,
the more support you have in terms of healing, it is faster now
Yes,
or
doctor.
quicker?
Yes, in fact, in my practice, I always involve the family, whether it's a
Uh-huh.
medical condition or a psychological, psychiatric condition.
Mhm.
I always involve the family
Right.
because, of course, they have to understand what's going on and to be more caring, more supportive, and more patient,
Mhm.
more tolerant towards
Mhm.
the patient.
Mhm. In fact, this is, I think, the other word for this is home health, right?
Yes, doctor.
So home health, it's an approach already in the U.S. But that's why there are a lot of home health nurses in the U.S. They're the ones going to the homes, injecting insulin, taking care of wounds in their homes.
You have to empower the patient and the
Mhm.
family
Right.
to do whatever they can to
Mhm.
help the patient
Mhm.
recover
Mhm.
and recuperate.
Yeah. But I think in the Philippines, we are kind of late on that kind of approach. The home health concept is still not as, as common as the ones in the U.S.
Yes, but since you already started awareness
Uh-huh.
of this, then we're on our way.
I know, yeah. I think we are the first team of healthcare professionals that would really push for this kind of approach in healthcare.
I think, well, there have been some already
Uh-huh.
existing.
But now, what I'm talking about in Eastwood City area.
Yes.
Yeah, we are the first to do that.
Yes.
This is our pilot community, and hopefully we can later on, as our team grows and we have more people getting involved with us, probably we can go outside of Eastwood City.
Yes, doctor. Of course, they are very, very busy here, and
Mhm.
some people tend to focus so much on work. They
Mhm.
value their work so much that sometimes they tend to forget that
Mhm.
they also need care,
Mhm.
health
Right.
care,
Uh-huh.
to be able to be more functional and to have.
Mhm.
A
What do you
more
think about,
years.
Doctor, in terms of cost on the professional fees? Do you think some people they think that well, if it's home health or like house calls or they call it home service, like a beautician going or a barber going or they say that it's more costly. Do you think that applies to the healthcare professional? When you go to the homes or offices, it would be more costly.
It cannot be helped that there would be some additional cost because
Mhm.
of the time and the travel
Mhm.
that will be above here, but it's going to be worth it and it's reasonable.
Yeah.
Okay, and it's also socialized.
I know. So that is not something that you really would worry about, the cost. No. Anyway, I mean,
it's going to be a fair assessment of the costs.
and when it comes to health, the price is not really an issue.
Yes, doctor. It's always worth it if it concerns your health.
I know.